Hi, my name is Christie Cole. I am a master's student at the School of Population and Public Health at UBC.
Hi, my name is Catherine Steer. I'm an undergraduate honors student at the University of British Columbia in the Faculty of Science. Our study is on cycling, air pollution and health. Cycling has been promoted as a healthy transportation choice. However, there's been some concern that cyclists may be exposed to elevated levels of air pollution due to their proximity to cars when cycling. Our study had 38 healthy cyclists ride along two separate routes with a 14-day washout period. One of the routes went through a high traffic area in the downtown core of Vancouver, and the second route went through a low traffic area along the residential part of Vancouver, which is Cypress Street and a Midtown Ridgeway, a major bicycling pathway. Air pollution monitors were attached to the bicycle in order to examine the particulate matter levels along the routes. What we found was that endothelial dysfunction increased significantly after riding along the higher traffic route compared to the lower traffic route. And furthermore, that there was a 56% higher increase in ultrafine particle levels compared to the low traffic route in the high traffic route. In conclusion, cyclists riding for an hour on a high traffic route may experience acute adverse health effects, specifically in endothelial function. However, whether or not this is mediated by classical pathways of systemic inflammation or oxidative stress remains unclear.
So cycling is an active form of transportation, which is great for everyone's health. You know, we're always looking for reasons or ways, I guess, to help with the obesity epidemic that's going on. One thing with cycling is that because you're exercising, you're breathing more rapidly, taking deeper breaths. So it's important to consider that air pollution that one is breathing while cycling might be a substantially larger dose than someone who's sitting quietly in their car. So we have to account for the dose aspect as well, and that's partially why we were using the air pollution monitoring instruments on the bike and also in the lab afterwards, which we will apply to this research later on. The primary investigator for this is Dr. Michael Brower, and I guess initiated this idea as my master's thesis project, and then Catherine came on as an honors student who had some more interest in the blood biomarkers, and so she was able to analyze the inflammatory biomarkers, and I had more focus on some of the respiratory and the endothelial function effects.
And actually, to be honest, there was this great study done by Megan Winters at UBC, in cycling in cities, and she showed that one of the motivators for cycling is if it's away from traffic. And what we wanted to make sure is that people are cycling in terms of getting exercise, because cycling is great for your health. We don't want, obviously there shouldn't be this concern about air pollution, and that's one of the reasons why we're doing this study, is that if there is a concern, then we can motivate, we can change this, we can try to decrease the effects of air pollution, especially in North America as well.